I'm Katie Wilcoxon, and I'm a pediatrician with Boys Town Pediatrics at the Maple Street Clinic. I'm here to talk to you about what to expect at your well visit. The first thing I want to talk about is what to expect when you get discharged from the hospital. A lot of people think when they get discharged from the hospital that they're supposed to know everything they need to know about their baby, and that is absolutely not the case. There's going to be lots of questions and concerns and things that you don't know how to handle. Just know that your physician is there for you, and that a lot of these things we will talk about at your first well visit. Your first well visit is going to happen when your baby is about 3 to 5 days of life. If you have a vaginal birth, you're going to stay in the hospital for 2 nights. If you have a C-section, you'll stay for 3 to 4 nights. And always encourage families with their first baby to stay in the hospital for the entire time that your insurance covers, because that gives you extra time to have access to your doctors, nurses, and lactation consultants so that you feel very comfortable when you get discharged. At your first well visit at 3 to 5 days of life, the 2 main things that we're going to be looking for are your baby's weight and their jaundice level. All babies lose weight in the first few days of life. That's something that's very normal and physiological for babies. Babies are allowed to lose up to 10% of their birth weight, and so we'll check your baby's weight compared to their birth weight to make sure that your baby hasn't lost too much weight. In about 3 days after delivery, your milk will come in, and that will sustain your baby and help them to gain weight after that. The jaundice level is called bilirubin. That's something that's produced in red blood cells, and as those red blood cells break down, the liver takes care of that. It can take baby's liver a little bit of time to wake up and be able to start processing that bilirubin. In the meantime, your baby may have a slight yellow tone to their skin, and that is very typical in the first few days of life. We'll oftentimes look and possibly do a blood test to measure baby's bilirubin to make sure that that jaundice level is not too high. At your visit, we'll also do a head-to-toe exam of your baby to make sure that they're healthy. We'll check their heart, their lungs, their belly. We'll check their skin for any jaundice or rashes. We'll check their head to make sure that their soft spot is healthy. We'll also take a look at your baby's umbilical cord, and if applicable, we'll take a look at their circumcision to make sure it's healing correctly. This is also a great time for us to check in with parents to see how they're doing mentally after having a baby. There's a lot of changes in the first few weeks of life, and so we want to make sure that we're screening for any postpartum depression or anxiety, and just checking in to make sure that parents are doing okay. The next time that we'll see your baby, if everything goes well at that visit, is at 2 weeks of life, because that's when we expect that babies have regained back to their birth weight. We'll see your baby very frequently in the first few years of life for well visits. This is to make sure that your baby is growing and developing appropriately, but don't worry, these do space out as your baby gets older. In the first 2 years of life, we'll see you every few months. We'll measure height, weight, head circumference in babies, and then as your kid gets older, we'll check body mass index to make sure that they're growing appropriately. We'll check in with you to make sure that they're meeting all of their developmental milestones at an appropriate time and refer if necessary. We'll also do some health maintenance screenings like lead screening, hemoglobin screening, and as your child gets older, we'll screen for things like depression and anxiety. This is also a great time to update your child on vaccines. Vaccines are also going to be most frequent with visits in the first 2 years of life, and then we'll space out. The vaccine schedule recommended by the CDC is the best schedule to follow, and that's what we will recommend for your child. Your baby's first vaccine is going to be a hepatitis B shot that is given in the hospital prior to discharge. Their next set is going to be at 2 months of age. Now let's go ahead and take a look at an exam room so you know what to expect when you come in for your first visit. When you come to your well visit, a nurse will pick you up from our waiting room and take you to our vital signs station over here. At the station, your nurse will get your height, weight, temperature, and any other vital signs we need for your visit. Then she'll take you to our exam room. In our exam rooms, we have a computer station for your doctor to take notes, a few comfortable chairs for you to sit in while your child is getting examined, and a table for your child to sit on during the examination. We hope this gives you an idea of what to expect at your well visit. We at Boys Town Pediatrics want to make you feel comfortable and confident in those first few days of your new baby's life. We are always here for any questions, concerns you have. You can always call your pediatrician. Congratulations on your new baby.